Okay. Thank you for being here tonight at the Katie Wellness Institute for week 2 of the autism presentations. This month I am doing presentations because October is Vaccine Injury Awareness Month. So this is the second of what will be 4 presentations, and last week we talked about we kind of did an overview, autism is treatable, and this week's presentation is autism is medical, so it's kind of a natural extension of the fact that autism is treatable. So tonight we're really going to talk a lot about the immune system disruption in autism spectrum disorders. So basic tenet is autism is a medical illness. It is not a mental illness. Children who are diagnosed with autism are more likely to have recurrent ear infections and upper respiratory infections than their non-autistic peers. Children with autism and ADHD often have histories of much more frequent antibiotic administration than do NT kids, and that's neurotypical kids, neurotypical. The incidence of gastrointestinal problems in infancy and early childhood, such as diarrhea, constipation, reflux, projectile vomiting, is higher in ASD kids than neurotypical kids. And ASD is that autism spectrum disorder. And just FYI, when I talk about the ASD and the autism spectrum, I include ADHD in that spectrum because they have so many things in common and a lot of the similar underlying issues. So gastrointestinal disorders are very, very common in kids with autism. Up here, Valicenti and McDermott in 2006 evaluated children with ASD and 2 control groups matched for age, sex, and ethnicity. One with non-autism related developmental disorders and the other developmentally normal. Those were the 2 control groups. There were 50 children in each group, and the findings included that 70% of the children with ASD had gastrointestinal issues compared to 42% of the children with developmental disorders other than ASD, and 28% of children with typical development. Just like everyone else, people with autism may suffer from gastritis, GERD, colitis, irritable bowel syndrome, constipation, motility-based disorders, and overgrowth syndromes of the gastrointestinal tract. Here at the Katie Wellness Institute, one of the things that I use when I'm seeing somebody is a developmental history form, and it's a lengthy form, and I ask a lot of questions. And so one of the things I look for are kind of patterns and things, and I'm looking for, is there a link between family history and what do we see in these kids? So oftentimes I see that I have trouble with this. Family history often reveals first-degree relatives, mom, dad, or siblings with gastrointestinal diagnoses. And those diagnoses may be celiac disease, Crohn's disease, irritable bowel syndrome, and food allergies and intolerances. And often there's a history of cancers of the digestive system in grandparents, such as stomach cancer, esophageal cancer, and colorectal cancer. So there is evidence of a genetic kind of predisposition to gastrointestinal problems that may be affecting these children. Symptoms of celiac disease, I'm going to go over some of these things that we might see in these children. Symptoms vary from person to person. Symptoms may occur in the digestive system itself or in other parts of the body. So digestive symptoms are more common in infants and young children and may include abdominal bloating and pain, chronic diarrhea, vomiting, constipation, pale, foul-smelling or fatty stools, and weight loss. Other symptoms of celiac disease include irritability, which is a very common symptom in children. And you think about that, if a child is in chronic pain, they're not going to be a happy camper. So you'll see a lot of irritability. And that is especially common in children. You might see children who are nonverbal and can't tell you that their stomach hurts or that their bellies hurt. A lot of times their irritability, their pain will come out in irritability and aggression in different ways. Malabsorption of nutrients during the years when nutrition is critical to a child's normal growth and development can result in other problems such as failure to thrive, which means being below the 10th percentile in height and weight, weight in particular, delayed growth and short stature, delayed puberty, and dental enamel defects of the permanent teeth. And that's because they're not absorbing their minerals, and they're not getting the necessary nutrients that are required for them to have strong teeth or normal teeth. Something else that I see is late teething in these kids. They won't, my daughter was one of those. She didn't cut her first tooth until she was 11 months old, and she didn't cut her second tooth until she was 16 months old. So I ask about that too. So, how old was your child when they cut their first tooth, and were they late getting their teeth? And that seems to be an indication that there's a mineral imbalance going on there. So in adults, adults are less likely to have digestive symptoms and may instead have one or more of the following: unexplained iron deficiency anemia, fatigue, bone or joint pain, arthritis, bone loss or osteoporosis, depression or anxiety, tingling or numbness in the hands and feet, seizures, missed menstrual periods, infertility or recurrent miscarriage, canker sores on the inside of the mouth, an itchy skin rash called dermatitis herpetiformis. So we think of celiac disease as something that affects the gastrointestinal tract, but what this is saying is that in some people, and adults in particular, it may not really present as gastrointestinal problems. There may be other issues, and if you have these other issues and you haven't been checked, then that might be an indication that you want to get checked for celiac disease. So there are comorbid diagnoses, which means you have more than one diagnosis. Along with the celiac disease, you might have some other things going on. So the people with celiac disease tend to have other diseases in which the immune system attacks the body's healthy cells and tissues. The connection between celiac disease and these diseases may be genetic, and they include type 1 diabetes, autoimmune thyroid disease, autoimmune liver disease, and rheumatoid arthritis. I put a box around these because I really want to highlight those, but other ones would be Addison's disease, which is a condition in which the glands that produce the critical hormones are damaged. Addison's has to do with your adrenal function. And Sjogren's syndrome, which is a condition in which the glands that produce tears and saliva are destroyed. So they'll have really dry mouth, dry eyes, and that extends to the internal organs. I highlighted this because type 1 diabetes, autoimmune thyroid disease, autoimmune liver disease, and rheumatoid arthritis are things that are very commonly seen in first-degree relatives of children who are on the autism spectrum, particularly autoimmune thyroid disease and rheumatoid arthritis. So bacterial infections are also very common in children diagnosed on the spectrum, and one of those that we see most prevalently is C. diff, or Clostridium. Overgrowth of the gastrointestinal tract by multiple Clostridium species may be as important as yeast or fungal overgrowth in the etiology of a wide range of disorders, and that's from Dr. William Shaw. This is a study, the title of the study is Increased Urinary Excretion of 3-hydroxyphenyl 3-hydroxypropionic acid, or HPHPA, that's what we're going to call it, which is an abnormal phenylalanine metabolite of Clostridia species in the gastrointestinal tract in urine samples from patients with autism and schizophrenia. So from the abstract, and I'm not going to read all of this, but what this is, they found this HPHPA in higher concentrations in urine samples of children with autism compared to age and sex appropriate controls, and in an adult with recurrent diarrhea due to Clostridium difficile infections. The highest value measured in urine samples was 7,500 millimoles per mole creatinine, as a value which was 300 times the median normal adult value in a patient with acute schizophrenia during an acute psychotic episode. The psychosis remitted after treatment with oral vancomycin with a concomitant marked decrease in HPHPA. And I'm going to skip down here. The significance of this compound is that it is a probable metabolite of M-tyrosine, and I'll skip over that, a tyrosine analog which depletes brain catecholamines and causes symptoms of autism, such as stereotypical behavior, hyperactivity, and hyperreactivity in experimental animals. So this is really strong evidence that there's bacterial overgrowth, bacterial problem associated with Clostridium in the guts of these children, and that's one of the frequent findings that emerges on the organic acid test. So autism is a medical illness, and we look for clues of that. One is the developmental histories of children with autism frequently include febrile seizures and fevers of unknown origin. Kids on the spectrum often have histories of suspicious rashes, hives, and warts, which is an indication that there's something viral probably going on underneath that we don't know. I mean, I just remember when my daughter was little and taking her over and over and over and over and over again to the emergency room or to the pediatrician, and he's saying it's viral, we don't know what it is. Or it's an unknown, fever of unknown origin. Some children never get sick, but when we test them, we find they have high antibodies to viruses and bacterial infections and autoantibodies, including those to brain proteins. So what kind of viral infections would we look for? HSV, which is herpes simplex virus, type 1, is the one that's associated with cold sores, but only 10% of people who are infected will break out. Someone who carries the virus can spread it even if they've never had a cold sore. It can also be, it can also go from mother to child in utero, even if you don't know you have it. It can lead to herpes simplex encephalitis, which is brain swelling with alteration of consciousness, fever, dysphagia, ataxia, seizures, and these seizures can be either focal or generalized. So this is something that we test for. Herpes simplex virus type 2 is the genital herpes, which is one of the most prevalent sexually, or HSV type 2, one of the most prevalent sexually transmitted diseases, which affects more than 1 in 5 sexually active adults. And after primary infection, often a debilitating systemic disease, the virus establishes latency in the spinal cord ganglia, or in the CNS. Recurrent viral reactivations can be symptomatic or can be entirely asymptomatic. So you may not know if you're having a flare. All people infected with HSV2 shed the virus asymptomatically. So when people think that they can't spread herpes to others if they don't have active infection, signs of active infections, that's not true. They can spread it. Antivirals have been shown to decrease symptomatic recurrences of genital herpes and to decrease the frequency of viral shedding, but there is no current evidence that they prevent transmission of HSV to newborns. So again, from mother to child in utero. And it can cause encephalitis and meningitis in newborns and children, so brain swelling and infections of the meninges, which is the covering of the brain. So viral infections in autism continued. HHV6 is a big one. That's one we see almost universally. Children that I see have high viral titers to HHV6. That's not real uncommon in the general population. Used to be that, and probably still would be the case if you go to a pediatrician or your general practitioner and you say, I think my child has HHV6 or has been exposed to HHV6, they'd say, so what? Because most kids are exposed by the time they're 5. So it's not unusual for them to have evidence of this. The difference used to be that we used to think that HHV6 was not problematic unless you had significant immune system problems. So it was known to be a problem for somebody who had HIV or AIDS. It's also a problem in children with autism spectrum disorder because they have so many other things going on in their immune systems. And here's some of the evidence for that. These are some of the studies in the peer-reviewed medical literature associating human herpes virus number 6 co-infections in the blood of patients with autistic spectrum disorders. This was also talking about HHV6 in autism, serological association of measles virus, and human herpes number 6 with brain autoantibodies in autism. This is a really interesting series of research studies that were done by Dr. Vahendra Singh. And what he found was in a significant subset of children with autism who had both very high measles titers, much higher than you would expect to find in a child who's been vaccinated against measles. These kids will have measles titers that are way above what is necessary to establish evidence of immunity. And they would have, in combination with these very high measles titers, they would also have high human herpes number 6 titers. And in about 30% of those kids, they would also have evidence of brain autoantibodies, autoantibodies to myelin basic protein and neuron axon filament protein. And those are very important for how the brain shares information across areas of the brain, from one area front to back, side to side, and within the sensory integration parts of the brain. So what does HHV6 do? It infects white blood cells. It is a cause of childhood roseola. Symptoms include fever, distinct type of rash. Most infants are infected with HHV6 before age 2. Many display mild or no symptoms. Some symptoms, such as fever, may be incorrectly attributed to conditions other than roseola. A small number of infected infants can develop serious disease, including bone marrow infection, decreased production of white blood cells and platelets, and brain infections, which often manifest as seizures. Symptoms noted in infants with roseola include fever, swollen glands, lethargy, and fatigue, nervous system complications, and bone marrow suppression. HHV6 is known to infect and destroy the cells that produce myelin, the fatty coating that surrounds and protects nerve cells. HHV6 demonstrates the ability to cause disruption of the normal functioning of the human immune system. So it targets the brain and it targets the immune system. And that's what we see in these kids on the autism spectrum. After initial infection with HHV6, the virus is often dormant for a time but may reactivate later in childhood or in adults. Reactivation of HHV6 in normal adults has been associated with mononucleosis syndrome, autoimmune disorders, and nervous system diseases. In recent studies, HHV6 has been implicated in multiple sclerosis with 56% positive and chronic fatigue syndrome with 39% positive. Cytomegalovirus is another one of the herpes viruses. So what I'm talking about right here is the herpes family of viruses, which is really important in these kids and adults. So between 50% and 85% of people in the United States have had a cytomegalovirus infection by the time they are 40 years old. CMV infections are rarely serious in otherwise healthy kids and adults. They usually cause only mild symptoms, if any. When symptoms do appear, they are similar to those seen in mono and only last a few weeks. Once a person has had a CMV infection, the virus usually lies dormant or inactive in the body, but it can be reactivated. And the virus is more likely to be reactivated and cause serious illness in people who have weakened immune systems. So again, it's this kind of may not be problematic if you're really strong and your immune system is robust, but if you have a weakened immune system, this could be much more serious for you. Infants who are infected before birth may have no symptoms. However, they may develop hearing, vision, neurologic, and developmental problems over time. In a few cases, there are symptoms at birth which can include premature delivery, being small for gestational age, jaundice, enlarged liver and spleen, microcephaly or small head, seizures, rash, feeding difficulties, and these infants are also at high risk for developing hearing, vision, neurologic, and developmental problems. So newborns can acquire CMV infection during or soon after birth by passing through the birth canal of an infected mother, consuming breast milk from a mother with the virus, or receiving a transfusion of donated blood donated by a person infected with CMV. Vulnerable infants who contract CMV may develop pneumonia or other symptoms. Premature and ill full-term infants who are infected soon after birth are at risk for neurological and developmental problems over time. CMV infection after the newborn period may lead to pneumonia, hepatitis, which is inflammation of the liver, or a rash in vulnerable infants and children. In people whose immune systems are weakened, CMV can cause serious infections of the lung, nervous system, gastrointestinal tract, and the eye. All right, so these are some of the published medical literature citations for if you do a search for autism, cytomegalovirus with autism on PubMed. And they go back quite a while. Let's see, that's 2006, 2005, 2005, 2004, 2003, 1990. 1980, 1978, 1977, 1974. So the point about this is there's some significant information out there, and it goes back a long while. This is not new stuff. It's just stuff you don't hear about, because everybody wants to think that autism is a mental illness. So these are some, I did some PubMed searches because I want to go to the medical literature, and I just searched for certain viruses with autism. And I found 7 citations for Epstein-Barr virus with autism, 11 citations for Lyme disease with autism, 26 for Clostridia with autism, 11 for chronic measles infection with autism, 17 for varicella with autism, and 77 for PANDAS. And PANDAS, whoops, we're going to talk about in a little bit, but PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcus. And we'll talk more about that in a little bit. All right, so this is a child that I saw here, actually at Katie Wellness Institute, who had persistent measles infection from vaccination. Prior to getting sick with measles, after receiving the MMR vaccine at 15 months, he was happy and healthy. He was normally active, easy to feed, slept well. He was cuddly and easy to hold. He was coordinated. He crawled at 6 months. He walked independently at 13 months. His language was developing and he had several words. He was a very social baby who smiled and laughed and liked to be around people. After the MMR vaccine, he would go in his room, close the door, and wouldn't let you in. After the MMR vaccination, this formerly happy, healthy little boy started getting sick a lot. He had recurrent bronchitis, fever above 104 degrees, frequent rashes, including lots of diaper rash, bright red rash on his cheeks, on his face, a bright red ring around the anus, a fine red rash on his upper arms and legs that looked like chicken skin. He sweated a lot, especially in his head, hands, and feet, and had really bad sweaty feet. That's sometimes a sign of bacterial infection in the gut, sweaty hands and feet and head. He developed allergies to milk and eggs and certain weeds. He had recurrent chronic ear infections that were treated with multiple rounds of antibiotics. He became extremely sensitive to sounds and began putting his hands over his ears. He developed diarrhea. His stools were mushy and watery and extremely frequent, up to 10 times a day. His stools contained lots of undigested food, and he farted frequently and burped a lot. And he was diagnosed with autism. He stopped making eye contact and he stopped talking. 17 months after his MMR vaccine, he got measles again. He had a chronic measles infection in his gut, and this is what happened to him when he got it again. So a lot of people who listen to mainstream media and who hear just a little bit about Andrew Wakefield and hear about the measles vaccine and the MMR vaccine will hear that there's no information, there's nothing out there about MMR and autism or gastrointestinal illness or anything else other than Dr. Wakefield, and that is absolutely not true. This is just a sampling of the peer-reviewed medical literature addressing MMR vaccine and bowel disease. This one is actually Dr. Wakefield's 1995 study that was published in The Lancet. This is one from 1989. Here's one from 1990. Here's one from 94. Here's one from 1995, 93, 95, 95. And then this one is one of the most recent ones. I've got to update this, but I found this one, Epidemiological Characteristics of 500 Patients with Inflammatory Bowel Disease in Iran, studied from 2004 through 2007. And this is that same study, the one I just mentioned here. That's the original article. There's the date up here, the Archives of Iranian Medicine, 2009, it was published. This is a table here, and it looks at the different demographic and historical characteristics of irritable bowel disease patients. And what I wanted to highlight here is there is a history of gastrointestinal problem and bowel disease after measles. That's been known for a long time. So they looked at history of measles infection. 74 out of their total N of, with Crohn's disease, a total N of 207. So 74 of those, which was 35.7%, had a history of measles infection. History of measles vaccination was double that. So 72%, or 150, had a history of measles vaccination. So it was double. Same thing in ulcerative colitis with an N of 293. Over here you have 123 or 42% with history of measles infection and 214 or 73% with history of measles vaccination. So let's talk about PANDAS. PANDAS is pediatric autoimmune neuropsychiatric disorder associated with streptococcus. It's an autoimmune response to a strep infection. A child will frequently not look sick, but will have sky-high strep titers. Waxing and waning presentation of tics, especially coughing and throat clearing. They'll do that. OCD behaviors, hyperactivity, and arguing. And they'll have an autoimmune attack, which is against the basal ganglia in the brain. Some kids will not have the coughing and tic presentation. They'll just have a lot of hyperactivity that comes and goes. So this is waxing, waning kind of presentation. Oftentimes you'll see this happen to these kids at the beginning of the school year when everybody else is getting sick and everybody else has tonsillitis or strep throat and they're all on antibiotics, and this kid is not running a fever, not complaining of a sore throat or anything, but the behavior is off the charts all of a sudden. And that's a clue that they may be having an autoimmune response to a strep infection. A subset of children with PANDAS will develop gastrointestinal illness with nausea, vomiting, and pain after eating. That may present as anorexia or failure to thrive. There's a subset of children, and there seems to be, and there is some literature to back this up, it seems to be some of these young ladies who develop anorexia at the age of 12 or 13 may stop eating because when they eat, it's painful. And they're diagnosed with anorexia, and then they go through all of the mental health kind of interventions that are designed to address the psychological aspect of things, but if this is something that needs to be ruled out. So infections often easily treated with antibiotics. They are prone to chronic strep, post-strep hives, and peeling feet. This is what we had in our family, the post-strep hives, just hives for at 1.5 months straight every day. You'll hear about people who are strep carriers and people who have chronic strep. This is another thing I ask about in that family medical history is, do the parents have, anybody else in the family have a history of chronic strep? Because it may be something that's genetic, and seems to be. It can cause damage to the basal ganglia, which is cumulative, so it's very important to be diligent and proactive with treatment. It's not just the basal ganglia. Untreated strep can cause heart problems and can kill somebody. So it's really, really important. And children, the incidence of PANDAS in children diagnosed with autism spectrum disorders is at least 30%. So any child who has an ASD diagnosis needs to be checked for this. These are some other acronyms that are used. It started out as PANDAS, and then it became known also as PANS and PITAND. And PANS is Pediatric Acute Onset Neuropsychiatric Syndrome. We already talked about PANDAS. And PITAND is Pediatric Infection-Triggered Autoimmune Neuropsychiatric Disorders. It started out with just thinking it was strep, and then they realized it could be other bacterial, viral, microbial issues that are associated with this. So it has kind of broadened, and now PANS and PITAND are under the umbrella of PANS. So what they all have in common is that it is sudden onset, waxing and waning of symptoms based on clinical presentation, which may or may not be supported by laboratory findings. Sometimes you won't get high strep titers, or you might not be able to isolate what virus or what bacteria is causing this. But if you address the overall immune system and work to strengthen the immune system and improve the health of the child, some of these things go away. So what you might see in the clinical presentation are obsessions and or compulsions, synonyms chorea or choreiform movements, tics, emotional lability including rages, personality changes, age regression, separation anxiety, oppositional defiant disorder, tactile sensitivity and defensiveness, ADHD, major depression, marked deterioration in handwriting and or math skills, urinary urgency or frequency or enuresis, and anorexia. So if you have a child who is potty trained and who doesn't have a history, is not bedwetting, and all of a sudden starts having issues with bedwetting or with wetting accidents during the day, that's another clue to look at. Okay, so in addition to the viral and bacterial infections that we've talked about, we talk about the yeast beast, the fungal infection, fungal overgrowth of the gastrointestinal tract. And this is, we call it the yeast beast for a reason. So frequent bacterial infections such as strep, bronchitis, sinus, ears lead to frequent antibiotic administration. Remember, these kids have histories of chronic ear infections and upper respiratory infections and that kind of stuff from infancy. So they're getting a lot of antibiotics. A lot of them are also C-section babies. So they did not pass through the birth canal, and they did not get the colonization of the gut that they would have gotten had they passed through the birth canal. So they're starting off with their ecosystem being not balanced like it should be. And then if they have antibiotics because they're sick a lot, then that further wipes out that balance of good bacteria versus bad bacteria in the gut. So viral infections and IgE-related ear infections are often treated with antibiotics, which does nothing other than wipe out the good gut bugs, providing a fertile environment for overgrowth of the bad guys. A lot of these kids have milk allergies, and they will develop when they're eating a lot of milk products, they're drinking a lot of milk, and they will get a lot of fluid buildup behind their ears, and they look like they have ear infections, so they get bacteria that go to the doctor. Doctor says it's got fluid behind the ears, it's a bacterial infection, they give them an antibiotic, and it's not a bacterial infection, it's a milk allergy. So, all right, Candida albicans. That's a type of yeast that we see most frequently in children with autism. Overgrowth of yeast in the GI tract is almost universal in ASD kids. I don't think I've ever seen one that did not have this. Clues to overgrowth of yeast in the GI tract, and it's important to note that everybody has yeast in their gastrointestinal tract. You're supposed to have some there. Where it becomes problematic is when you have too much of these particular types of yeast that are really tough guys, and not enough of the ones to balance them out. So you get this, when we look at yeast and we do laboratory analysis, we do an organic acid test and we do comprehensive digestive stool analysis, and we look for evidence and we look for metabolites of the yeast, and we look, you know, if we see that there's yeast there, but there's the Candida albicans metabolites in the urine, and it's within the range of what is considered to be normal, that's not a problem. What's a problem is when it gets way outside of the range, and that's when we start seeing really, you know, all kinds of behavioral clues. So some clues about yeast are a history of ear infections, strep, bronchitis, and antibiotics, redness and puffiness between the nail bed and the first knuckle on the fingers, flatulence, bloating, and stinky farts, red ears and cheeks, rashes, peeling skin, athlete's foot, ridged, discolored nails, toe walking, inappropriate laughter, constipation, diarrhea, and mucus in the stools. Inappropriate laughter is, I just want to talk just a little bit about yeast and what yeast does. Yeast produces alcohol. It produces acetaldehyde, which is an alcohol, which causes drunk behavior. So you have these kids who, they look like they're drunk and they're acting like they're drunk, and they are. It's because they're producing their own alcohol. It will cause food cravings, and they'll crave carbs, sugars, yeasty things, and fermented things. Okay, Just talked about this, I'm getting ahead of myself. They seem drunk, silly, or out of it. They have an imbalance between copper and zinc, which further depletes the immune system, increasing vulnerability to opportunistic infections. And they often have co-infection with Clostridia, which is a bacterial, viruses, and parasites. So there's all of this stuff together in the gastrointestinal tract. And the longer they're there together, the more they love each other, and the more they don't want to give each other up. So they will fight to maintain that homeostasis. The longer it's all there, the harder it is to treat any one thing. And because they love each other and they don't want to give each other up, if you only treat one thing, a lot of people will just treat yeast. And if you just treat yeast and you don't assess and also look at viruses and bacteria and co-occurring infections and treat everything simultaneously, then as one thing comes down, something else might go up, because they want to maintain that homeostasis. So why are these kids so vulnerable? Kenneth Bach wrote a book in 2008 called The 4A Disorders, and the 4A disorders are autism, ADHD, asthma, and allergies. And there's a fifth one there, which is autoimmunity. Okay? But we're going to talk about these. He talked about the new childhood epidemics, and noted that the increase over the past 2 decades in autism was 1,500%, and ADHD was 400%, asthma was 300%, and asthma deaths have increased by 56%. Allergies have increased by 400%, and approximately 20% of American children have at least one allergy. Peanut allergy has more than doubled since 1997, and 200 people, many of them children, now die from food allergies every year. When I was a kid, I was born in 1960. When I was a kid, I didn't know anybody who had allergies. I had a cousin who had hay fever and allergies, but other than that, I mean, none of my classmates that I knew had any kind of allergies. What I heard about occasionally was somebody that had a shellfish allergy. That was the one that I would hear about. But certainly nobody with life-threatening peanut allergies. Now you can't, in many classrooms, you can't have peanut butter in the classroom. You can't have, there are specific rules, because in every classroom in the United States, there are kids who, if they are exposed to this, some of these kids, if they even breathe something in the air, they can have an anaphylactic reaction and die. That didn't used to be the case. We would have noticed that. That's not better diagnosis. So these are some facts and statistics from about food allergies, and this comes from the foodallergy.org website. So researchers estimate that up to 15 million Americans have food allergies. This potentially deadly disease affects 1 in every 13 children under 18 years of age in the United States. So that's roughly 2 in every classroom. The economic cost of children's food allergies is nearly $25 billion per year, and they're on the rise. According to a study released in 2013 by the CDC, the Centers for Disease Control and Prevention, food allergies among children increased approximately 50% between 1997 and 2011. And hospital admissions for severe reactions in children have risen 7-fold over the past decade, according to the European Academy of Allergy and Clinical Immunology. Every 3 minutes, a food allergy reaction sends someone to the emergency department. And that is more than 200,000 emergency department visits per year. The US CDC reported that food allergies result in more than 300,000 ambulatory care visits a year among children under the age of 18, and it is the leading cause of anaphylaxis outside the hospital setting. So it's not a small issue. 8 foods account for 90% of all reactions, and they are milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. And even trace amounts of a food allergen can cause a reaction. So let's talk about vaccines and allergies. Can vaccines cause peanut allergy? Yes. Before 1900, reactions to peanuts were unheard of. Today, almost 1.5 million children in this country are allergic to peanuts. Peanut allergy is the #1 cause of death from food reactions. Peanut oil is cheap to produce, Refined peanut oil was widely adopted as an excipient of choice in the production of vaccines during the 1960s. It is still widely used today for this purpose. So it is injected along with toxins into the body, and the body learns to recognize that food protein as a toxin. The change came with vaccines. This is from Dr. Tim O'Shea. Peanut oils were introduced as vaccine excipients in the mid-1960s. By 1980, they had become the preferred excipient. They were considered adjuvants, substances able to increase reactivity to the vaccine. This reinforced the adjuvant myth, the illusion that immune response is the same as immunity. The pretense being that the stronger the allergic response to the vaccine, the greater will be the immunity that is conferred. What this means is, when you get a vaccine that has an adjuvant in it, an adjuvant is designed to ramp up the immune response. So it allows the vaccine manufacturer to use smaller fractions of the virus or the bacteria, so it's cheaper to produce. So when you get a vaccine that contains a virus and an adjuvant together, your body responds to that adjuvant, and it ramps up your immune response, and you develop antibodies. So when they test for antibodies to determine whether or not you have evidence of immunity, there's no proof, there's no real evidence, no scientific proof that what you are reacting to is the virus or the bacteria. Your body may be reacting to the adjuvant. And that's what he's talking about when he talks about the adjuvant myth. So let me go back to that real quickly. The adjuvant myth. This is about, it's a form of classical conditioning. When I was in graduate school for psychology, when we learned about classical conditioning, the body is very good at detecting poisons. So one of the things that we learned about was that animals in the wild, they'll go to, if they eat something that is toxic, the body will produce a very strong reaction and they will never go to it again, because the body responds and knows that that is something that will kill you. Same thing happens when we're injected with toxins or when we consume toxins. And for example, I absolutely love chili. As a child, I loved chili, but at one church function I recall going to, I got some chili that was bad. And I got sick, and I got really sick. And it was years before I could even smell chili without feeling nauseous, because my body learned real quick that that was bad stuff and I should not touch it because it will make me sick. So it's that kind of classical conditioning response. When a food protein is injected along with toxins, the body learns to recognize that food protein as toxin. Okay? All right, so let's talk about more about vaccines and allergies. Hepatitis B vaccine and yeast allergy. Yeast is one of the things we see coming back on food allergy tests, allergies to yeast very, very frequently. These are taken from the hepatitis, the Engerix, right here. This is from the vaccine manufacturer's insert, taken off the web. So it says contraindications for the hepatitis B vaccine: severe allergic reaction or anaphylaxis after a previous dose of any hepatitis B vaccine, hepatitis B containing vaccine, or to any component of Engerix B, including yeast, is a contraindication to administration of Engerix B. Okay? This is the description. Engerix B is a sterile suspension of non-infectious hepatitis B virus surface antigen for intramuscular administration. It contains purified surface antigen of the virus obtained by culturing genetically engineered GMO Saccharomyces cerevisiae cells. This is yeast, which carry the surface antigen gene of the hepatitis B virus. This is expressed in the cells, purified by several physiochemical steps and formulated to a suspension of the antigen absorbed on aluminum hydroxide, neuro and immune toxic. The procedures used to manufacture it result in a product that contains no more than 5% yeast protein. Each 0.5 milliliter pediatric adolescent dose contains 10 micrograms of this hepatitis B antigen absorbed on 0.25 milligrams, which is 250 micrograms of aluminum as aluminum hydroxide. So what this says is they've combined a genetically modified virus, or fraction of a virus, recombinant fraction of a virus, with a genetically modified food protein, and they've paired it with a neuroimmune toxin, and they inject it into infants on the first day of life. This is a big problem with the yeast issue because these infants are being injected within 12 hours of birth. And remember I said the longer something is there, the harder it is to get rid of. Their bodies do not recognize, their immune systems are not developed enough to determine self and other at that point in time. So this yeast becomes a part of them. And their bodies don't recognize it as something that they need to fight, so it's really hard to get rid of. That's a big problem with the yeast issue that we're talking about, the yeast beast. Okay, so continuing on with vaccines and allergens. How about flu vaccines and egg allergy? Everybody heard about people can't get the flu vaccine because they have an egg allergy? Well, the vaccine manufacturers are fixing that because now they are making flu vaccines with cultured on worms, on insects. So that's a way that they're going to try to convince us that we can now get flu vaccines, because even if we're allergic to eggs. So, contraindication for the flu vaccine: do not administer Fluvaval to anyone with a history of severe allergic reaction or to any component of the vaccine, including egg protein, or following a previous dose of any influenza vaccine. All right, so why is that a problem? Because Fluvaval is cultured on embryonated hen's eggs. And it is paired with thimerosal, which is mercury, which is neuro and immune toxic. Some of us now have egg allergies that didn't used to have egg allergies because we got flu shots. I would be one of those. All right, so vaccines and allergies. The DTaP, Tdap, and milk allergy. This is one I didn't know about until just not very long ago. This is the American Academy of Allergy, Asthma, and Immunology. That's what that stands for. This was a poster presentation from March 24th, 2011, and the authors stated, "We observed several children with severe milk allergy to have reacted to the common childhood vaccine called the DPT." That's a misnomer. It was actually the DTaP, the diphtheria, tetanus, and acellular pertussis vaccine, or tetanus booster, which would include the Tdap, given to older children and adults. This is the Dr. Sicherer. He explained in an email to MedPage today in response to questions. "We believe that the vaccine may have very trace milk proteins in some lots." The protein was identified as case amino acids derived from cow's milk, contained in medium used to process the vaccines. This is a quote from the doctor. He says, "These cases were an observation in a relatively short period of 2.5 years where we encountered 7 children in one practice with milk allergy having a severe anaphylactic reaction to the injection of the DPT shot. We then used a very sensitive immunoassay to look for the presence of milk protein in vials of Adacel, which was Adacel is actually the Tdap that they received." So this was older kids. This wasn't little ones. This is older kids. Of the 2 vials we looked at, one of them clearly had milk protein in it. They were shocked. These are allergists and immunologists, and they are like, what is milk protein? This is a contamination issue. We're looking at more lots to get an issue whether this is an uncommon phenomenon or not. We were struck by the fact that just in our practice we had 7 patients with milk allergy who had these severe reactions, and we believe it is due to contamination of milk protein in this vaccine. This is very preliminary, but if I had an extremely milk allergic subject, I would take caution. My daughter has a milk allergy, and she almost died 3 hours after she got that Tdap, that Adacel. Nobody ever told us anything about it being cultured on milk protein. And they're not telling anybody else either. So is it contamination in some lots? This is from the Adacel vaccine manufacturer's insert. Adacel vaccine is a sterile isotonic suspension of tetanus and diphtheria toxoids and pertussis antigens adsorbed on aluminum phosphate for intramuscular injection. Each 5.5 milliliter dose contains 5, whatever that is, tetanus toxoid, diphtheria toxoid, acellular pertussis antigens, 2.5 micrograms, and whatever. Filament, and it goes through all of this stuff, okay? So basically, here's what I want you to see. 1.5 milligrams aluminum phosphate. That's 1,500 micrograms of aluminum. Aluminum is limited in parenteral solutions by the FDA to 5 micrograms per kilogram of body weight over a 24-hour period of time. In parenteral solutions, at IV solutions, and the reason it's limited to that is because when they were giving it in higher amounts, it was causing brain damage and causing kidneys to shut down. So they've limited it in IV solutions given to adults and children, but there is no limitation on the amount of aluminum that is injected into infants and children via vaccines. So there's 1,500 micrograms or 1.5 milligrams of aluminum phosphate as the adjuvant to ramp up that immune system, plus formaldehyde, glutaraldehyde, 2-phenoxyethanol as a preservative, not as a preservative. The antigens are the same as those in Daptocel vaccine. However, Adacel vaccine is formulated with reduced quantities of diphtheria and detoxified pertussis and tetanus. So what does all that mean? The acellular pertussis vaccine also, whoops, what did I do there? There it is. Components are produced from Bordetella pertussis cultures grown in this medium modified by the addition of case amino acids. There it is right there. It wasn't contamination. It's in the vaccine. And they know it's in the vaccine. And they're not telling anybody. All right, so we've got acellular pertussis, case amino acids. Tetanus toxin is produced from Clostridium tetani. Clostridia, remember Clostridia, that bad boy that gets in the guts? Grown in another Mueller-Miller case amino acid medium without beef heart infusion. Combined with aluminum phosphate as an adjuvant and 2-phenoxyethanol, not as a preservative. So, take-home message on this, injecting toxins along with milk proteins. Problems for kids who already have milk allergies, and a really good way to induce a milk allergy. Contraindications. This is directly from the manufacturer's insert. It says, a severe allergic reaction, anaphylaxis after previous dose of any tetanus toxoid, diphtheria toxoid, or pertussis containing vaccine, or any other component of this vaccine is a contraindication. So if somebody has a milk allergy, they're not supposed to get this vaccine. But nobody's being told this. The only thing, what they're saying is everybody has to get it, everybody has to get it again and again and again, more and more and more, including pregnant women. Okay, heavy metals. Mercury and lead. Low-dose mercury toxicity causes damage to various organ systems and causes deficits in language, memory, and attention, disruption of fine motor function, atopic eczema, immune dysregulation, including immune deficiency and autoimmunity. Low levels of lead cause behavioral problems, learning disabilities, lower intelligence scores, which are IQ in children. Lead plus mercury together. The effects of low levels of lead and mercury together are much greater than the effects of either alone. Dr. Bach, in his book, The 4A's, biological insults from both lead and mercury, as well as some chemicals, can lead to a Th2, T helper type 2, skewed immune system with an increase in humoral or antibody immunity as compared to cellular immunity. This can result in excessive allergies and autoimmunity. So what happens, what he's talking about is that the body's immune system, the first line of the immune system is cellular immunity, not humoral immunity, not the blood. We're bypassing the body's first line of defense when we're injecting things into muscle and then it goes into the blood instead of going through mouth, nose, and gastrointestinal tract. And what that causes is excessive allergies and autoimmunity because it skews the balance between the immune system. So aluminum and autoimmunity. This is a study that was done, where's the date? I don't have a date on it. Recent study, 2011 I believe it was. Might even be more recent than that. Looked at aluminum in the central nervous system, toxicity in humans and animals, vaccine adjuvants, and autoimmunity. This is from the abstract. We have examined neurotoxicity of aluminum in humans and animals under various conditions following different routes of administration and provide an overview of the various associated disease states. The literature demonstrates clearly negative impacts of aluminum on the nervous system across the age span. In adults, aluminum exposure can lead to apparently age-related neurological deficits resembling Alzheimer's and has been linked to this disease. In young children, a highly significant correlation exists between the number of pediatric aluminum adjuvanted vaccines administered and the rate of autism spectrum disorders. Many of the features of aluminum-induced neurotoxicity may arise in part from autoimmune reactions as part of, this is the ASIA syndrome, which is autoimmune syndrome induced by adjuvants. So Th2 skewing and inflammation causes chronic inflammation, which is a common factor in the 4A disorders. Causes are underlying infections, allergies or sensitivities to food or inhalants, exposures to toxic heavy metals and chemicals, and multiple nutritional deficiencies and imbalances. So it's not, the message with this is, it's not one thing. It's a complex interaction between multiple factors. So when you have a complex interaction between multiple factors, you have to have a comprehensive approach. So we have to address all of the underlying factors. We have to decrease environmental exposures, avoid allergens. We modify the diet to help avoid those food allergies, and also to reduce the feeding of the yeast with carbs and sugars and fermented things. We use nutritional supplementation, especially antioxidants, B vitamins, essential fatty acids, probiotics, and prebiotics. Detoxification, very, very important. Repair methylation and sulfation pathways to prevent further toxic buildup. That's so important, especially when you live in an environment where there's a whole lot of toxins in our area. We've got all of these coal-burning power plants. We've got lots of heavy metals in our environment. We have lots of pesticides. We've got a lot of farming activity and pesticides. So we've got more toxins in our area than a lot of people do. So that makes it even more important for us to look at the methylation and sulfation pathways. And we test for that, we look at that, we target supplementation to repair those pathways. Treat underlying infections, which may be covert. So when we do a comprehensive digestive stool analysis and we see that there's no evidence of parasites, we don't assume that there are no parasites. We always assume that there are parasites, and we're going to do everything, we're going to treat comprehensively as if they are there, even if we don't have. And the way we do that is through removing their food sources, by changing the diet, and by using non-prescriptive, whenever possible, non-prescriptive natural antiparasitic agents. There are certain things that are naturally antiparasitic, antiviral, antibacterial, antimicrobial that we can use. And we use small amounts of different things so that we get a synergistic effect. And if we don't test, how do we know? We don't know. So we test. And we go by what we find in the tests. So comprehensive approach to testing includes quantitative viral titers. We talked about those viruses. We look at HSV type 1 and 2, HHV6, Cytomegalovirus, Epstein-Barr virus, measles, mumps, rubella, varicella. If immunity is established, rationale for not vaccinating with a booster. We're also looking at hepatitis B. I recently am seeing a little girl who's 4 years old, was fully vaccinated and in infancy against hepatitis with everything. Infancy through 2 years, has zero evidence of immunity to hepatitis B and zero evidence of immunity to varicella. Very common. So again, we're vaccinating and putting in all of these toxins and no evidence of any benefit. So antiviral medications include Valtrex, monolaurin, and lauricidin. We also use non-prescriptive antivirals. This is our go-to stuff. Vitamin A, grapefruit seed extract, olive leaf extract, lithium, and lithium is elemental lithium or lithium orotate in most cases in low doses. And elemental lithium is a natural antiviral for herpes viruses. And almost universally, when I do hair analysis on these kids, they are flat on lithium. They don't have any lithium at all. And adults too, and a lot of adults who have chronic fatigue syndrome and fibromyalgia, they have these overgrowth of these viruses or these chronic activation of viruses, of these herpes viruses, and their lithium is flat. So we work to elevate the lithium, and that simultaneously helps to bring down those viruses. So other labs we look at, anti-streptolysin, anti-DNAs, those are for strep. And if we find evidence of strep, then we would treat with antibiotics because we want to be aggressive with strep and we want to make sure that we get it. So we might use IM bicillin. Oral Bagam is one that is also used. LDN, low-dose naltrexone and Actos is also has been used successfully against strep. Some non-prescriptives can be very helpful in treating strep and keeping it down, keeping it from resurfacing once we get it under control. And we would increase probiotics and prebiotics. And IVIG is another therapy that is often used for strep. Organic acid tests, these are labs that we frequently order. The organic acid test, the comprehensive digestive stool analysis, that helps us look at what's going on in the gut. We look for Clostridia, parasites, and yeast, and if we find them, we would use prescription antifungals, antibacterials, antimicrobials, non-prescriptive agents, again, grapefruit seed extract, oil of oregano, very powerful antiviral, antibacterial, antifungal, antiparasitic. Great stuff, non-prescription, very good stuff. Aloe vera juice, toxic to yeast, good stuff. Caprylic acid, also toxic to yeast, and there are many others that we can use. And that's what we want to do, is build our arsenal, because we don't want to give the enemy time to figure out what we're coming at them with. So, and dietary changes, very, very, very important. Probiotics, prebiotics, and digestive enzymes. These are so helpful. Digestive enzymes are wonderful for helping to break down those foods so that we're not feeding those guys, because they live off of undigested food in the gut. So if we break them down and help crowd them out, then that gives us another tool in our bag of tricks. So what we want to do is we want to balance Th1 and Th2. We want to balance that immune system and bring that inflammation down and help relieve those allergies and that asthma and boost that immune system so that we've got more of an effective response to pathogens. And so that means that we might use colostrum, transfer factor, probiotics, prebiotics, IVIG, and oral immunoglobulins. We want to assess and address heavy metals with detoxification, and depending on what we find, we would possibly use folinic acid, not folic acid. Folic acid is synthetic and the body often does not recognize it, particularly if you have certain genetic SNPs in your DNA. So we would look at folinic acid or methylfolate. Methyl B12, or in some cases adenosyl or hydroxy B12. There are some kids and some adults who cannot handle methyl B12. So we want to look at that before we supplement. We want to look at the lithium level, because if you give B12, and when lithium is flat, B12 and lithium are kind of a seesaw. You give B12, you're going to deplete lithium even further, and lithium is necessary to walk folate into the central nervous system. So it's all about sequential events. TMG and DMG are also very helpful. And chelation, and that's oh my gosh, chelation, that word. But what I'm talking about is helping the body repair itself so we can get to a level where the body is kicking in and starting to chelate on its own naturally. And that can happen. What we might also do is oral chelation with very low doses. We do not do high dose chelation, we don't do IV chelation, and we don't do provocation tests, because we want to make sure that the body is repaired and is able to detoxify and get rid of whatever we pull out. We don't want to pull toxins from hiding places in the body if the body is not able to get rid of those toxins, because then they will just recirculate and they might go into the brain where they weren't before, and we definitely don't want to do that. So that's my take on chelation. Oops. So this is I think the last one. Autism is treatable, recovery is possible. The approach must be comprehensive. It must be a logical, data-driven approach. It requires a team approach between parents and clinicians. We work together. You tell me what you think you're seeing. We talk about it. We communicate back and forth. Recovery from autism is not a sprint, it's a marathon. This requires us to adjust our thought processes away from everything we have learned about from conventional medicine. Suppressing symptoms is quick, but it rarely lasts if underlying illness goes unaddressed. And reversing chronic illness takes time, but it can be done, and it is being done. So, any questions? Is your brain going? Yeah.